co-host here. And then we'll start recording the meeting. Yes. Great. Well, welcome everyone to the first meeting of the Universal Health Plan Governance Board. I am Morgan Cowling. I'm the executive director. I use she, her pronouns, and I am just thrilled to be here and starting this journey with you all. I have a couple of meeting logistics to take care of. This is a public meeting and members of the public are welcome to listen and watch either here in the room or virtually. Meeting participation by members of the public online or in the room will be really limited to public comment at the end of the meeting, and we will make sure we have one person who signed up virtually, and we'll check the list and make sure at the end of the meeting there's opportunity for public comment. So with that, we have disabled the chat function for everybody, and only governance board members in the Zoom will be able to turn on their cameras and speak during agenda items. And Katie will be managing that and watching for a raised hand function, and we'll make sure to allow for our governance board members who are attending virtually to actively participate in this meeting. We have a packed agenda, so with that, I'm going to turn it over to some of the guests we've invited to offer a welcome. Representative Nelson was going to be attending virtually. Is he in the Zoom room? He is not.
Representative Nelson's trying to find a quiet place at the conference he's at, so he should be on shortly. Sorry, this is Amy Beth, his chief of staff.
Well, thank you, Amy Beth. And while he is trying to find a quiet place, I'll turn it over to Senator Manning, who carried the bill that created the governance board on the Senate floor and helped create this board.
Well, thank you. I am really excited. Senator James Manning. I am the Senate President Pro Tem. I have a little vocal condition called Accentia spasmodic phonia, which means that treatment or Botox injections I get in my larynx. So I'm experiencing a point called whisper voice, where it may be a little difficult to understand what I'm saying or hear me. No, the Botox injection does not make my neck look younger. Get that out of the way. So I'm so excited about this. I worked on this bill on the universal health care for 7 years. I started off in 2017 with Senator Michael Denbrook. It didn't pass in 2017. 2018, I assumed the role of first chief sponsor. Out of that work came the Universal Healthcare Task Force, Senate Bill 770. Some of our task force members, I'm pleased to say, are part of this governance board. The work that they provided was so comprehensive. It was about this thick. They did a thorough, inclusive job, reaching out to all Oregonians. I found that they spoke to people that I had no idea where they even live. They went to all corners of the state. I am so honored. I did a report, and I'll finish up real quick, but it's really important. I did an interview prior to coming here with a reporter. And one of the main topics.
It's like there are certain parameters of information that we need to collect.
And one of the topics that we talked about was Oregon and a universal health care. Leading the nation. Every state has eyes on Oregon about this. I guesstimate between 2 and 5 years, things work out well. Oregon will be the first state in the nation to have an independent body that will have and apply a universal health care single payer for all Oregonians. My vision, my insight, your help, your direction. Oregon will lead the nation. I'm looking forward to doing whatever I can do to help you out. Executive Director, thank you for coming on board. Board members, thank you for stepping up, volunteering your time, your talent. I try to get you paid, but you get some compensation. But we're getting off to the start. We'll fill in the gaps as we go ahead. Thank you.
Thank you. Thank you for being here. I'm gonna check in and see if Representative Nelson is. Not yet. All right, then I will turn it over to DCBS Director Stolfi to welcome the board.
Thank you, Morgan. I'll try to stall long enough for Rep. Nelson. Oh, happy for Representative.
Representative Nelson, welcome to the Universal Health Plan Governance Board. Would you like to say a couple words of welcome?
Try that one more time.
Representative Nelson, are you able to hear us? We cannot yet hear you. Okay, while we get that figured
All
out.
right, I will help stall a little bit longer. But good afternoon, everyone. My name is Andrew Stolfi. I'm the Director of the Department of Consumer and Business Services, DCBS. I'm also the State Insurance Commissioner. And it's a real pleasure to help welcome you to this first meeting. And I'll be brief unless I need to be longer. But just want to congratulate you on getting to this stage. Senator Manning and others did a spectacular job at just getting us to this spot. And now you have the hard work of figuring out how to implement a single payer system. It's a great state. It's something that we at the department and me as the commissioner paid a lot of attention to. I'll call, say, Professor Goldberg and his co-professor, and they even invited me to speak to their class at Portland State a year or so ago about this topic, among others. So it's certainly something we're very interested in. You do know that the board is part of DCBS. You're an independent board, and but you're kind of part of our umbrella, and that's our way of supporting the board, providing a lot of resources. I can't tell you how much work went into just getting to today, and really want to commend Morgan and the staff for getting you to here, so now that you can start that great work ahead. So again, just want to emphasize that DCBS as a whole, especially our division of financial regulation, which is where our insurance regulatory staff sit. We're here as a resource to provide research and assistance, whatever it is that needed. I should note we put up a kind of a ethical firewall, so to speak, between the division and the board, just to make sure no one thinks there's any collaboration or working together, undue kind of working together, so that as you're developing your recommendations and your plan, no one has to worry that the regulators are trying to steer you in any one direction as you reach your recommendation. So with that, just welcome again. I'm glad to join you. I've got to leave in a little bit. I'm giving a presentation to the Oregon Climate Action Commission on all the climate related things our agency is doing in a little bit, but hope you don't mind if I pop into your meetings and be here to, again, help in any way possible. Thank you.
Thank you. Thank you for those words. And I do see Representative Nelson has found a location, and I'm gonna see if unmuting the representative will help. Representative, are you able to, well, I know you can speak, but can you hear us?
I can hear you, Morgan. Thank you so much for your patience. Look, everybody, I'm at the NatCon conference in St. Louis. So it was a little difficult for me to find a quiet place to speak. There's about 6,000-ish people at this conference. It's kind of crazy, but I really wanted to be here as you guys kicked off your first meeting The work that you are doing, that you will do, is going to be life-changing for so many Oregonians. And as somebody who's been a staunch advocate for single-payer healthcare for 2 decades now, I'm personally excited in the work that you're going to be doing, and I look forward to being somebody in the not-too-distant future in our legislature that will sponsor legislation that is based on the recommendations that you all come up with. So I just want to say good luck. I know you're going to do great work. If there's anything that my office can do to help, please let me know. I see my Chief of Staff, Amy Beth Altenhofen, is on the call as well. So feel free to reach out to any of us if there's anything that I can ever do to be assistance to this, to the work that this board is doing. So thank you so much. Good luck. And every so often I will probably pop my head in just to see how things are going. But I know you guys are going to do some phenomenal things. So good luck today.
Wonderful. Thank you. And thank you for being available and finding a spot to welcome the board. And in my excitement to kick off the work, I missed some basics. We need to do roll call and make sure that we have a quorum. And so, Katie, would you do roll call for us?
Absolutely. Helen Blanca. Here. Chin Wei Chi.
Here.
Deborah Diaz. Here. Amy Fellows. Here. Warren George.
Here.
Michelle Glass.
Present.
Bruce Goldberg.
Here.
Judy Richardson. Here. And Cheryl Ramirez. Here. Thank you.
Wonderful. And now, since it's our first board meeting, we should do introductions for the board. Your bios are included in the welcome packet, so you don't need to say what's in your bio, but maybe share one unique thing that's not on your resume that maybe we wouldn't necessarily know about you, or share some reason why you are here. And why don't we start with our board members who are participating virtually. Michelle, would you like to start?
Thank you, Executive Director. Hello, everyone. My name is Michelle Glass. I use she and her pronouns. And the first thing that came to mind that folks may not know is when I was in my 20s, when the national fight for the Affordable Care Act, what became the Affordable Care Act, was happening. I was an uninsured single mom that was going to college full-time and working, and I was representing Southern Oregon and got to go to Washington, D.C. to lobby for universal coverage at that time. And that really kicked off a passion in my life for this work. So I'm really excited to be part of this important body of work with all of you. And I look forward to learning and working together. Thank you.
Thank you. And Dr. Chi?
Good afternoon. It is a pleasure to meet with everyone virtually because I have a class later, so I unfortunately I cannot participate in person. I started volunteer to promote universal healthcare in Oregon since 1997. And in 2002, I was involved in Oregon's first ballot measure to promote universal healthcare. And throughout the last 2 decades, I continue to work locally and nationally to promote universal healthcare, as well as I have been serving as a policy advisor on and off for Taiwan's national health insurance program that will be celebrating its 30th anniversary next year. And this year, I was invited to contribute a paper to review Taiwan's national health insurance is a universal healthcare single-payer system. So I'm so excited to be able to learn from everyone as well as to share my knowledge and experience. Thank you.
Thank you. And would you like to go next?
Sure. Hi, everybody. I'm Judy Richardson. It's my pleasure and honor to be here among you and be standing on the shoulders of giants. I'm a family physician at OHSU, and I teach healthcare economics also at OHSU. And I think my compelling why is hearing my students who struggle with health system reform and beg for a solution and believing that we as Oregonians can do hard things. So, thank you.
Hi, everyone. I'm Helen Belanca. I'm also a family physician. I'm currently doing clinical work with Northwest Permanente. But I came to Oregon from the Midwest because of the Oregon Health Plan, which is one of the ways that Oregon has always led the nation, and have been really thrilled to be part of all of the various reform efforts that have happened in our state. It seems to me that healthcare is always about service and stewardship. And so if you really believe in service and stewardship, and universal health care and a single payer plan are the most obvious solution. So that's why I'm here. And one thing that's not on my resume is I'm an amateur astronomer. And I just got back from traveling to see the eclipse. I've become one of those people that travels now to see eclipses. So it was very fun.
Hi, Bruce Goldberg. I too am a family doc, but what you don't know is that I help manage care for an elderly mother, a wife, and several grandchildren. And none of them anymore ask me for medical advice. My life tends to be in the policy world. I've been spending about 40 years actually working to assure that everybody can get the healthcare that they need. And this work is just a real extension of that. Really appreciate the opportunity to be there.
Hi, everyone. I'm Deborah Diaz. I prefer to go by Debbie. My pronouns are she, her. I will take a page out of Michelle's book and share where I was when the Affordable Care Act passed. I was actually in my first year of PA school. I'm a physician assistant, physician associate, depending who you ask. Name changes in progress. And we were actually in our class and stopped our lecture, much to the horror of our OB-GYN lecturer, and went ahead and broadcasted the live coverage. And that has definitely cemented in my mind just a really positive and pivotal point, and looking forward to serving on this board too.
My name is Warren George. I live near Corvallis. Was a member of the Universal Healthcare Task Force, along with Bruce and Cheryl. In my main career, I was director of primary operations and plant manager for one of Oregon's largest employers, a titanium producer. After that, I became a business consultant specializing in large startups. I really like to work with people and with data. Something less known about me: when I was 10 years old, Condi McCullough, the famous bridge engineer, was my idol, and I wanted to grow up to be a bridge engineer. Well, Vietnam War and some other things kind of changed plans, but in my 60s, working as a consultant, I worked with Oregon State University, took a tour. They were trying to develop a reinforcing material for old concrete bridges. I proposed titanium, and now the rest is history. We've developed a new product in conjunction with Oregon State that is, of all things, helping to extend the life of Condi McCullough bridges. So sometimes life goes all the way around. Thank you.
Hi, I'm Amy Fellows. I'm the executive director of a small nonprofit called We Can Do Better, that our former governor, Kitzhaber, founded as the Archimedes movement. And listening to you all, I was thinking about when I was an undergrad at Oregon State studying healthcare administration, and actually Dr. Chi was one of my professors. I went to one of Kitzhaber's library public events about the Oregon Health Plan back in the early 90s, and that kind of sparked my interest. I also, the Affordable Care Act happened at a life transition time when I was leaving a job, and I benefited from the insurance exchange. And I have a disabled teenager that receives K-Plan OHP through DDS services, which is part of the Affordable Care Act as well. So I just want to be here to make sure that that we are supporting all Oregonians in every way that we can.
I'm Cheryl Ramirez. I'm the director of the Association of Oregon Community Mental Health Programs. I've spent about the last 20 years advocating for the public behavioral health and IDD systems, intellectual developmental disability systems. And I also have a hat in terms of small business because I direct a very small not-for-profit, and I've seen our insurance premiums skyrocket every year they go up, as well as the deductibles. So I'd like to see something different. Something that you don't know about me is I was born in Germany, and I've never heard my German relatives complain about healthcare ever.
Well, welcome, everyone. With that, we will go to the next agenda item, which is an executive session. I'm going to read this and so we'll go into executive session pursuant to ORS 192-660-2F to consider information or records that are exempt by law from public inspection. Representatives of the news media and designated staff shall be allowed to attend the executive session. All other members of the public may not attend. The public may stay in the Zoom room, and Katie has been working to set up a breakout room for the members of the public to go there. The recording of the meeting will be paused. No decisions will be made in executive session. And news media, if you're on the Zoom, you can text Katie, and Katie will make sure that you will stay in this room and listen to the executive session. And I am saying all of that, so if there are members of the news media, they have time to reach out to Katie before we kind of get the Zoom breakout room set up. And Jenny is also making sure that Katie to do roll call to make sure we have a quorum reconvening.
All right. Helen Blanca
Here.
here.
Cheryl Ramirez here. And Chenwei Chi
Present.
and Michelle Glass.
Present.
Thank you. Great. So next on the agenda is the election of the chair and vice chair. I will open up to board members to see if there are any nominations for chair. Before I do, I just want to run through a process. Members of the board are welcome to nominate themselves or any other board member. There are 2 or more nominees for chair or vice chair. The board member with the greatest number of votes, not necessarily a majority, will be elected. I will go through the process first for chair and then for vice chair. And then at the end of elections, I will turn over the meeting to the new chair. So would anyone like to nominate a board member for chair?
I would.
Bruce.
So I'd like to nominate Helen Blanca. Frighteningly, I have known Helen is frightening for both probably Helen and I. I've known Helen for several decades. And so I feel very confident in her ability to chair this group in a way that'll get our work done. So I'd like to place her name in nomination.
Wonderful. Helen, do you accept?
Yes, I do.
Wonderful. Are there any other nominations for chair? any objection to Helen Belanca being chair of the Universal Health Plan Governance Board? Seeing no objections, congratulations, your chair.
Thank you all. I'm really honored and humbled, and I'm really excited to work with all of you. I think this is a really great group. And I want to thank Dr. Goldberg for the nomination and the vote of confidence. And I think, like many of you in this room, we were hoping that Bruce would also step up as chair, but we are so grateful for any level of participation you can offer. I just want to say on behalf of, I think, all of us here, thank you for your work in chairing the task force and getting us to this point. You've given us a great foundation and a launching pad, and we're going to depend heavily on your wisdom and experience too. So thank you.
Accepted.
Wonderful. Would anyone like to make a nomination for vice chair? Bruce?
So I'd like to nominate Warren George. I haven't known Warren quite as long as the decades that I've known Helen, but I've worked really closely with Warren over the last couple of years through the task force. And I think that Warren's business expertise and Helen's healthcare expertise be a really pretty outstanding combination. I think Warren would be a great vice chair.
Wonderful. Warren.
I accept
Wonderful.
enthusiastically.
Are there any other nominations for chair? Seeing none, are there any objections to Warren being vice chair of the Universal Health Plan Governance Board? Seeing none, congratulations, vice chair.
Thank you. I'm excited to work with the board. I'm excited to work with Helen as the chair, and excited to get to work.
Wonderful. And with that, Helen, I will turn the facilitation of the rest of the meeting over to you.
Great. I think our first order of business is the executive director resolutions. These resolutions were proposed by Warren. Warren, would you like to give a little bit of background on the resolutions?
Thank you, Chair. It's a little bit awkward the way the original Senate Bill 1089 was formulated, with the executive director initially being selected through the executive appointments process. But then once we are named as a board, then she begins to work for us. So I wanted to kind of honor that with a acknowledgement that we're all here and we're all taking our roles. So I'm introducing resolution 1. Whereas Morgan Cowling has been duly appointed by the governor to serve as the initial executive director of the SB 1089 Universal Health Plan Governance Board. Whereas the executive director serves at the pleasure of the Universal Health Plan Governance Board once that body has been appointed and confirmed. The Universal Health Governance Board, having been confirmed and duly appointed, welcomes Morgan Cowling as our initial executive director.
Excellent. Yeah, and I just want to say a personal thank you to Morgan too for all the work she did in getting us all here. We've all been witness to how much went into just starting this meeting. So thank you so much for stepping up and doing such great work.
Thank you. Thank you.
Great. And then resolution 2. Warren, is there any additional background for resolution 2? Oh, we have to do a motion to approve resolution 1. Okay.
Yep.
Would someone like to make a motion to approve resolution 1? But Cheryl Ramirez. Everyone in favor? Aye.
Aye.
Great. So
Aye.
Resolution 1 is approved. Anyone opposed? Right. Okay. And then resolution 2, is there any additional background information?
Okay. As goes hand in hand that when a board begins to work with an executive director, that there be a process for us to evaluate and work with our executive director. So I've introduced resolution 2, whereas the executive director serves at the pleasure of the board, whereas the board has a desire to promote a collaborative relationship with its executive director, promote clear working environment for its director, the board shall appoint from its members an evaluation subcommittee of not less than 3 members, whose duties shall consist of: 1, not less than 90 days after passage of this resolution, shall draft an outline of expectations for the executive director, consisting of short sentences compatible with state law, to be improved by the entire board in regular session. And 2, shall meet no less frequently than annually for the purposes of preparing an evaluation of performance of the executive director in respect of the outline of expectations, for the purposes of meeting with the executive director to convey and discuss the evaluation of performance.
Is there a motion to approve resolution 2?
Sure, I'll move to approve resolution 2 as presented by Vice Chair George.
And then, is there, do
Do in a second, ask for a
do a
second.
second? Yeah. Does anyone have a second? Yeah, okay. And then, any discussion on the resolution? All those in favor, say aye or raise your hand. Aye.
I,
Anyone opposed? Okay, second resolution passes.
Welcome, Morgan.
Thank you. Okay, so now I will turn it over to Board Counsel Jacob Gill to review the draft policies and procedures. As a new state board, we're required to have policies and procedures, but the board does not need to take action of this today. We can get feedback and come back at a future meeting for final review and approval.
Thank you, Chair. Draft policies and procedures have been included with the packet and provided to you for your consideration and discussion. You'll see that they generally address the mechanics of board operation. They assign certain authority to the chair and to the executive director and board staff, and set out expectations for board members and the conduct of board business. It also includes a section on conflicts of interest. And it notes that public comment, while the board will accept written public comment in person is not, it's not something that's mandatory. It's something that is subject to the discretion of the board. And it refers to board policies as to when and how public comment will be provided to the board. You've also received a draft policy delegating certain specific authority in more detail to the executive director and the board staff. That is for the purpose of supporting and facilitating the operations of the board. Certainly, to the extent that you have questions about the policies, or if you have changes that you'd like to propose, please communicate those. We can either discuss those today, or you can communicate those directly to Executive Director Cowling, and I can work with her. And if necessary, we can address any legal issues, concerns, or other aspects of any proposed changes that you might have.
Have you had a chance to review the policies and procedures? If anyone has read through them and has anything they'd like to discuss, I think we have a few minutes to talk about that now. Anyone has concerns?
The procedures, they provide that they'll be reviewed annually. Certainly the board can make changes to those at any time.
So we would bring back any changes to the draft, maybe approve them at next meeting, but then can change them once a year. please take some time afterwards to review them and send any feedback to Morgan.
And just for process, if folks could get me any comments you have at least 2 weeks before whenever we set the next meeting is, so there would be enough time to get everybody's comments together and have time to review those with Jake and prior to the posting and the needs for getting materials out for the next meeting.
And if you feel that there should be additional policies or additional subject matter covered by the policies, don't hesitate to include that through comments. Thank you.
Thank you. Actually, I had a second. Okay, I'll turn it over to Morgan Cowling at this point to go over the welcome packet with us and the board responsibilities and deliverables.
Great. Thank you, Chair. Posted with the agenda and meeting materials is a welcome packet. There are a couple of things that I would like to do today and review, but there's just some background information in here that I won't go over that I wanted to make sure all of the board members had. One is a copy of Senate Bill 1089, which created the governance board and has the roles and responsibilities and you know, the law is in here. In addition, I've included Governor Kotek's signing letter. She signed 1089 into law, but also did so with a signing letter that I want to make sure we are all aware of and have as well. And then your bios, so that all of the board members, in addition just the introductions that we did today, you can read and get to know your fellow board members a little bit more. I will just say I did make one error that was pointed out to me in terms of the terms, you know, that they are staggered, they are in the board policies. I think I gave Amy 1 extra year by accident, and so I've updated her term on the website, but it is not correct in your board packet. So it's correct in your board policies and it's correct on the website. I also wanted to take an opportunity to introduce the staff that I've hired, and I'm so happy, giddy maybe is the right word, to have 2 new people on the team. I'm here with me at DCBS. The Senate Bill 1089 created 3 positions, myself, a senior policy advisor, and an executive assistant. And Jenny Donovan is our senior policy advisor. Would you like to introduce yourself and maybe just a quick what you were doing before this?
Sure. Hi, everyone. My name is Jennifer Donovan. I use she, her pronouns. So I'm your senior policy advisor. Previously, I've been at the Department of Education and at the Department of Veterans Affairs, the legislative director and legislative coordinator for EPA. And most recently, I was serving at ODE as the Safe and Inclusive Schools coordinator and suicide prevention and school safety. So
Thank you. And Katie DeLuca is our executive assistant.
yes. Hello. This is my second day working for the state of Oregon. So I'm with all the technology stuff. But I have previously been an executive assistant with AFLAC for the last several years, and then before that, an executive assistant to the director of the T-Mobile Call Center. So definitely several years supporting and being in an executive assistant role. With my time with AFLAC, I learned so much about the gaps in healthcare and you know, people that don't understand their coverage, they don't know how to get coverage, they can afford coverage. So I'm so excited just to get to support this team and what you guys do. So happy to be here.
Wonderful. And then in addition to the team, With me at the Department of Business and Consumer Services, there are going to be 2 limited duration positions at the Oregon Health Authority. And is Laurel able to say hello and share a little bit about the team at OHA?
Yep.
Hi, everyone. Can you hear me? Hi, Laurel Swerdlow. I use she and her pronouns. I serve as the coverage policy lead for the Division of Health Policy and Analytics within HPA. I actually kicked off my tenure with OHA working as supporting staff for the Universal Healthcare Task Force, Senate Bill 770. So it's great to be here with you all today. We, as Morgan said, have 2 limited duration policy analysts that we'll be hiring for. And as we are working through that hiring process, we have Devlin Prince, who will be serving as the main point person to be supporting Morgan and the DCBS team and you all as well in your work. And I will be supporting Devlin as well. So you'll have the 2 of us offering kind of that coverage in the interim as we're hiring those two positions that are dedicated to your all's work.
Thanks, Laura. And they've already been great, and Devlin has been participating and sat on the hiring committee for Jennifer, and has been already helping me get up to speed on a lot of the work that happened at the task force. So it's great to have the team at DCBS and then the extension into OHA and that knowledge and expertise there as well. So the last document in the welcome packet, I wanted to walk through a little bit more. Basically, I took Senate Bill 1089 and tried to translate it into more of a narrative and break it down into some more kind of digestible chunks. There's a little bit about the background, which we've been alluding to all throughout this afternoon's meeting, that Senate Bill 1089 really came from the groundbreaking work in Senate Bill 770 and the recommendation for a governance board that was made in those recommendations. There are a couple of pieces that changed through the negotiation and the legislative process. One is that the date that the comprehensive plan to finance and administer a universal health plan is due to the Oregon Legislature's healthcare committees by September 15th of 2026, which means that this governance board has 2.5 years of work. I think that was a little bit different timeline than the original 770 task force had outlined, and I'm grateful for the extra time for this board to be able to do that work. There are some, there's some kind of expectations that the Universal Health Plan developed will be responsive to the needs and expectations of the residents by improving the health status, defending against threats to the health of the residents. And really that language is directly from the statute that was so important to include about kind of the need to make sure the plan will really work for the people who live in Oregon. And then if you look at the second page, those board deliverables, there's the big plan, and I talk about the comprehensive plan to finance and administer a universal health plan. And then in addition to that, or as part of that, there are kind of these like secondary or mini plans within that big plan, that there's a financing and administrative structure for the universal health plan. There is, the need to identify that statutory authority and information technology infrastructure to administer a universal health plan. And then some more of those operational pieces, a plan to create an independent public corporation. The idea of the task force with this governance board would, oversee an independent public corporation that would be kind of outside of an existing state agency. And then to include a plan to create a universal health plan trust fund in the state treasury, separate and distinct from the general fund. So we've got this kind of big comprehensive plan, and then these smaller plans that are also a part of that plan. And then in the bill, they call out some specific considerations, some specific outreach to state agencies and specific partners, evaluate how to work with 9 federally recognized Indian tribes in Oregon and healthcare boards and commissions. You know, a lot of the work that's outlined in the bill is to be more outward facing and to think about how this would work with existing healthcare entities and those commissions, and to work collaboratively with partners across the healthcare systems, including hospitals, health systems, providers, and insurers, and coordinated care organizations. So lots of food for thought as we think about what needs to be in a work plan for the next 2.5 years. And then I call these other important considerations. Consider the recommendations of the Joint Task Force on Universal Healthcare. They made a lot of really strong recommendations, and those need to be an important consideration. Engage with regional organizations and study and address the impacts of the Universal Health Plan with respect to specific types of employers. So as you read through the task force report, you can see a lot of the work that they did, and then a lot of those recommendations on what needed to be done next outlined in Senate Bill 1089 and called out here. So I hope this can help be kind of a quick guide to some of the really big pieces that need to be in the work plan. And as we think about the next meetings, what might be helpful to think in content for the next meetings. I'll pause there and see if there's any questions or comments.
Well, I had I don't know whether this goes here or for the next, our topic about what we need at the next meeting. But I think given what you've laid out, that we've got, you know, a little over 2 years, which will go fairly quickly to develop a comprehensive plan, to finance and administer it, to create a trust and public corporation, that it would be really helpful to have a work plan that outlined exactly what committees and committee structure we're going to need, when and how we're going to elicit outside expertise to help us. You know, some of this is going to require staging. And I think it's going to be important to have a sense of where we're going as a board, and with that end date of September 2026. So having a work plan, knowing, giving some thought to committees and what we're going to need would be really helpful. And I think the sooner we have that, the more effectively we'll be able to work.
I could not agree more. I think that is everyone, including yourself, that I've talked to, kind of as I've been getting up to speed on this work, has said that the work plan is going to be key to getting this amount of work done in 2.5 years. And I think that that's actually a great transition to the next agenda item. Well, to the agenda item after this agenda item.
That's a good question. I wonder if there's a meaningful difference. We talk about committees of this board, work groups, and then technical advisory groups. Do we have like a standard definition of what those are, or are committees just subgroups of this board and work groups involve outside players? Like do we have, is there a standard definition for that, or how do we?
I don't have a standard definition yet. I think that should be part of our next steps, because I think there's a difference between them. I think that there are some really technical pieces that we would want some technical expertise, and that may influence who we invite or who we solicit or who wants to be on those committees, and more. I think of committees as a more generalized term, like more encompassing. And so I think that will need to be called out as we think about the work plan. I don't have a set of definitions off the top of my head, but I think it would be really easy to look at past work and make sure that we have those as we put together that work plan.
And will the work plan, or as we're building this, you know, we have all these other external things that are in motion that, you know, are expanding coverage in different ways. I think, you know, Medicaid waiver, being able to build Medicaid in the schools, the cultural yes bill that will expand for, you know, children with mental health challenges to be able to access learning like that. So like, I'm just trying to think about like, as we've been the building the plane while we're flying, and how we'll make sure that everybody, you know, how all that will work.
Yeah, I think that that's a really good question. And I think some of that level setting or foundation building might be something we want to invite a presentation from OHA to provide some information about what are the other reforms that are ongoing and parallel track to this work. So there can be that situational awareness as we embark. And I think that's also one of the areas why it's so wonderful to have the additional capacity at OHA to be able to work across the two agencies and keep that in mind. So maybe that's a future meeting request for a presentation at our next meeting is how I would think about operationalizing that.
If I might add, on behalf of the chairs, we're very anxious to learn more about particular interests. I know Morgan has spoken to all of you, and so as we begin thinking about assignments and the order of things that we have heard from all of you about particular things that you want to be involved in, and we can make sure that that happens in as the work plan and the schedule for the next couple of meetings takes place. I think just with the you know, brief things that we're hearing, we need to start with looking at, you know, is there some information deficits that would help the entire board to learn more things. And so we kind of all have a uniform understanding of the starting point. Certainly, I think it will be fairly obvious that since we're a follow-on to the task force, that we will want to maybe do some presentations of the high points of the task force very early on. And if other people have other suggestions, I hope you'll be free to talk to Morgan and anxious to get going on this. It will be quite a challenge for everyone. We'll have an opportunity to learn new things because we're doing things that no one's ever done before. So we're going to be learning, expanding our own abilities and knowledge, and also kind of taking inventory of where we lack information and where we can get that, and how we can be sure that we include stakeholders that are not represented here, but we want to be sure that they are represented in our work.
Well said. So next on the agenda, and I'll turn this over to the chair.
Yeah, so we need to establish a meeting calendar and a plan. Somewhat miraculously, it seems like the third Thursday of the month works for everyone, from what we can tell so far. And so the dates on the slide represent the third Thursday from May until December. Does that still look like it's going to work for everyone, 9 to 12 on the third Thursday? Can we commit to this schedule? Yes. Michelle and Dr. Chi.
Well, in general, for me, it works well, except 2 months. I already talked this with Morgan. On August, I will be out of the country for a project. And again, on December, I'm in charge of an international conference in Asia. So for this 2 months, those time will not work for me, but I don't think we should change that schedule because of me.
Does anyone else have any concerns about this schedule?
This is Michelle. This schedule generally works and I put holds on my calendar for these dates and times. I do think it might behoove us if the board is amenable to move our December meeting earlier in the month, potentially. December 19th might just be a trickier time of year in general. So other than that suggestion, even if the 19th really works well for everyone, I can make it a priority to make that work as well. But it is close to several important holidays, and I know a lot of people travel to be with family during the second half of the month. So wanted to just raise that.
Anyone else have concerns? We're also going to ask about meeting in person versus virtually. There certainly are a lot of advantages to meeting in person and getting to talk directly to each other. I think it makes for a better meeting, but we are definitely coming from a pretty spread out area. Do people have preferences about meeting in person or virtually, or a certain cadence, like, you know, meeting in person once a quarter and then virtually for the in-between meetings? Or in person all the time, virtual all the time? Does anyone have preferences about that?
I found that hybrid is working the best for land meetings. I don't think you can go back to fully in person ever, but I also think we lose a lot by being fully virtual all the time. So I would prefer just offering a hybrid version.
Every meeting, both in person and virtual, yeah.
Yeah, I also support the hybrid version. Whenever my schedule works, I would love to participate in person. Otherwise, I like the flexibility of being able to participate remote.
Similarly, I will need to participate remote for the most part, but plan to travel at least quarterly or at minimum twice a year to be in person. And I also think there's benefit to keeping, I think for participants for observers, hybrid meetings, I think are a little easier to track. They're a little bit more interactive than trying to watch a meeting that's happening in person somewhere that isn't at all focused on people who are observing remotely. So I think for the community engagement component, I also really appreciate the hybrid format.
I support hybrid, but what I would ask is that we could have the technology to have those board members that are remote, that we could actually see them. That would be really helpful and I think would add to the discussion.
That's good.
Can I add, that would be great. And I'm happy to be on camera. I also have not been able to see anyone from the meeting in Salem, like none of the presenters or with the exception of folks who were staff that were introducing themselves remotely. So it'd be great to have that be possible as well so that we can see folks who are present in person so we can all see each other and have that interaction. That'd be great.
Yeah, was assuming that would be two-way, Michelle. I totally support that.
And I think that was my error. Apologies, there's some first meeting technical difficulties. I needed to turn on the camera on this computer that's with the owl. And so it looks a little blurry on my computer, but at least there is a meeting room now. So we're figuring out the technology and we will be learning, and thank you all for your patience.
Does anyone have thoughts other than hybrid meeting or strong preferences for something other than doing every meeting as a hybrid meeting? Cool. That's great. That's great with me. Okay. So then next up is to kind of get a sense from people about what our future topics should cover. as has been said several times now by Bruce and Warren both, we have a tight timeline and we have a lot of sort of getting everybody on the same page and working together with the same information, as well as quickly developing a work plan and getting to work on some tasks that will take every bit of the time that we have. So there's this kind of simultaneous process where we need to learn and get grounded and get a work plan drafted and approved, set up some committees, work groups, technical advisory groups, and start the process. So we've kind of laid it out as a, you know, launching now in April, and in 5 months, it'll be September, and sort of this idea that over the next 5 months, we have a lot of background information to make sure that we have in common, especially the Joint Task Force report, making sure that we review that and understand what's in there and what's been done so far, where the gaps are, where we need to pick that up, identifying work groups and the consultants needed, and then developing and approving a work plan. We're hoping to get those done in the next couple of meetings. And then just kind of as an orientation thing, once September rolls around, we'll have 2 years until the deadline for our final report, with our first report to the legislature being this December 1st. So 2 years plus a little bit of extra time to get everyone caught up. We're not all going to be experts in every aspect of this. I kind of think of this work as, you know, there's the finances side of costs and revenues. There's the operations side of standing this up and making it function. There's the workforce piece where we have the healthcare providers, the healthcare delivery system, the benefit package, all of that work, and how that might change or not. And then there's communications. How do we bring everybody along with what we're doing, both the general public, the healthcare sector, special populations, the tribes? How do we communicate about what we're doing and make sure that that's clear? So we're not all going to be experts in all of those, but I'm hoping that each of us will find an area in there where we say, that's my jam. I really want to work on that piece of it. I'd really like to spend extra time there. And for the rest of us, we need at least a grounding in that information and in the work that needs to be done so that we can make decisions together. And so with that in mind, the next couple of meetings, we have definitely some priorities. Our first priority is making sure that we are all comfortable with the background information and recommendations of the task force. We're wondering if Bruce and anybody else he invites would give a presentation at our May meeting about the task force work and their recommendations, so that we can dig into that and be clear on what's there.
Happy to, so long as Cheryl and Warren chime in.
Yeah, we're lucky to have 3 members. And then we'll be developing a work plan based on those recommendations over the next couple of meetings. We're hoping to get that drafted fairly soon and approved, you know, within the next 2 or 3 meetings, so that we can start taking some action on those. But in addition to that, sort of simultaneously and kind of over the next few months, we want to provide more background information on specific topics, so that we can make decisions together. So as we've kind of grouped them into these categories, but we're wondering from this group, what additional information do you need on these topics other than what you've seen so far in the report, in the task force report? What do we need to focus on? Is there anything missing from here? If we were going to spend some time in this group sort of reviewing and learning together about where we stand. I already heard about OHA and their current strategies for reform and expansion of coverage. And so I think that's a great topic. Is there anything else that isn't mentioned so far that we need to review or talk about together as a way of background?
On the agency integration, don't forget ODDS, because there's a complete current silo and disconnect between those agencies.
Couple thoughts come to mind. One, not on that list, is ERISA, which will come up, and I think it's going to be important for all of us. to have a shared understanding of what ERISA is and is not. I also don't see on there, but I think implicit is how we go about community engagement on several fronts with one, the healthcare sector writ large, you know, two, the business sector, three, the general public, four, communities that have historically been unrecognized within our healthcare system, but to think about how we're going to solicit input and when and how, I think is going to be really important. And from who?
Yeah, on that last one, having Michelle, who's part of a regional health equity coalition, and connecting with that body of work.
In addition to ERISA, which is really applies to businesses, the VA and the tribal healthcare systems, I think are really interesting components here that I don't know much about how they would fit, if at all. So I think including them.
And I think another issue that's going to be important to discuss, and Amy reminded me, is going to be long-term care and understanding both the current systems that exist in the state around long-term care, but also I think there's some real considerations about whether that gets included or not as a benefit, which then has a lot of implications on financing and other things. So having, I think, some time where we can, I think, collectively understand that as an issue would be really important.
We have Dr. Chi available to us, who has overseen the implementation of universal healthcare in Taiwan and been part of that. I wonder about a presentation about how that went and the sort of the relevant pieces for this group to learn from, if that would be a possibility as well.
Yes, I would love to. And actually, right now I've been working on a paper of reviewing its achievement and challenge over the last 30 years. And once complete, I will be love to share that paper with everyone. One of the issue we might also want to start to consider, as I found out during the research on the review paper, was when Taiwan it went through 6 years of planning and legislations. So it was implemented in 1995. But one thing it got left out, and I think we should carefully consider, was explicitly stated two things. One is what should be the kind of underlying ethical foundation that we are building this system. And then based on that, we might want to explicitly state it, what should be the goal objective of the system. And both were missing from the Taiwanese National Health Insurance.
I think it'd be worthwhile looking at various models of universal health care, just brushing up on, like, you know, Canada and England and, you know, Germany. So just to see where they've gone in the last, I don't know, decade or so. I know I just recently rewatched the Frontline episode with T.R. Reid. Yeah, and this was like from 2008, I think. So I thought some things have happened. I'd really like to see an update. And I know we don't necessarily have experts who can talk about each of those, but maybe find something.
Michelle. Yeah, go ahead, Michelle.
Thank you. My hand was up earlier just with a request or a recommendation, I guess, that we, as we're deliberating in these public meetings, when possible, if we could just include a really quick definition if we use an acronym, so that for the benefit of each other, but also for the benefit of members of the public that may be watching this or watching the recording. And since we don't have the chat feature to utilize in that way, so I was just going to quickly drop that ERISA is the Employee Retirement Income Security Act, I believe was what you were referencing, but please correct me if I'm wrong there.
You've got it. Apologies for the acronym.
And then ODDS is the Oregon
Developmental Disability Services.
Oregon Developmental Disability Services.
Thank you. And acronyms are part of the work, so we'll all be practicing this a lot, I'm sure.
Also, one kind of hidden in the ERISA is an important issue we will need to address and deal with it, because part of the ERISA also allow corporate that when self-insured to be exempt from any state regulation.
Right. Right, that is something that came up in the task force work and will definitely need to be explored as part of our work too. Yes. Any other ideas for topics or things to, yes?
This might be in the healthcare delivery structure and workforce, but I want to make sure we're clear on what's in and what's out. I mean, besides long-term service care, we talked about a variety of human services and health-related services that aren't covered by Medicaid, for example, now. And who's in and out. I think we spent a lot of time on who can be covered under this plan and who cannot. So I think that's important.
In addition to what's been covered, I'm curious for folks who were part of the task force before, do you all feel that the task force review will give us an adequate amount of information about kind of any lessons learned from previous attempts here in the US and what we should replicate or be aware of and wary of in Oregon's plan here? Or do you feel like there's additional work that needs to be done there?
Additional work that needs to be done there. I don't think we had the time to really adequately explore that.
Yeah.
But on that note, Chunwei, I would be interested in, not just hearing about the Taiwanese system as it currently exists, but really about that transition from the old system to the new, and the lessons learned in making that transition.
Are you talking about the transition in Taiwan or any other country?
The one you've been most intimately involved with in Taiwan.
Oh, yes. Yes, I will be glad to share that.
I should say too that Morgan and the staff are also working to create a section on our website, which is a resource library where we can put papers and other documents that we can learn and review on our own too. I think we're gonna need that for sure as another resource, so that'll be available as well.
Yes, and one potential very helpful website resources will be the World Health Organization's universal health coverage. It provides very rich resources because the WHO has been promoting universal health coverage since the beginning of this century. And over the last 2 decades, they organized many conferences, workshops, and accumulated a lot of technical works, and they are all available in their website.
That's great. That's great. Excellent. So we do have one person who's requested a public comment. So we need to finish anything up before we do that. Okay, don't do that. Okay. So it looks like Tom Sinek is online or on the phone to provide public testimony. Tom, are you available?
I am. I'm so thankful, and I'll get right at it. But basically, I'm Tom Sinsick, I'm a retired nurse practitioner, and I got into this work because I saw the complexities of the care and the issue of going to prior authorizations and the cumbersome of wasting my time as a provider dealing with complexities rather than taking care of people. I want to say well done for what's up at the website and the staff and what they put forward for the deliverables and the outline here. And thank you for all those that stepped up to this board. It's really great. I do want to say, in reference to Dr. Chi, there is an outline of the principles and the moral compass that was carried forward from Senate Bill 770 to the 1089 bill. And I think keeping that as a focus really makes sense. I had a couple of comments about for you to consider around the policies. It looks like there might be maybe some clarity about what kind of interaction board members can have with the public on an individual basis outside of board meetings, right? We have a lot of strong relationships out here in terms of communicating with people about things. And then the issue where the board members themselves, a couple of them somebody might ask one of the other board members, what do they think about this or that? And is that policy that's written, is that too restrictive? I think it's something for you to consider. And then the issue of whether there should be a public comment on each meeting. I think there should be a public comment section, at least briefly, on each and every meeting. Right now, it seems to be optional by the draft policy. As a matter of something for you to know about, which is the Medicaid waivers, some of you may know that California passed their SB 770 to deal with the Medicaid waivers. So the partnerships with California, Washington might be an important agenda item to think about. Another item is, as you talk about consultants, and I think this has been brought up, I think Morgan's aware of it, certainly Senator Manning and Representative Nelson are, that there was kind of out there standing this issue of needed funding for the consultants. So as the issue of what the budget look like, I think that's going to have to be addressed, because the request for more funding and how soon that extra funding might come in. Do you need it sooner, or because this has gotten a little bit later start, you can wait until June of 2025 to get additional funding, or whether the agency should think about, or the board through the agency, asking for additional funding to get those consultants on board so the work can be done in a timely manner. And I think that's about it. Yeah. And then in terms of your committees, sometimes there's been talk in the committees of the past of getting volunteers that have expertise. If you can't afford the expertise, there are people in the community willing to help on a subcommittee that you could think about. So that's it. And like the hybrid meeting, because it gives the opportunity for the public to engage. And then the last comment is, I can have very good insight as to why we've gotten to where we are in Oregon, because we've taken the lessons learned from the other states. And the biggest lesson learned was failure to engage the community. And I think you keep that in mind as the thing, as you go forward in the plan for community engagement. That was the biggest downfall. And we've succeeded here because what we have been doing is engaging community. So thank you.
Thank you, Don. Anything else? Okay. So,
Chair, I might respond to
yes.
Tom,
Yes,
if I could.
absolutely.
I think he raises an important question, and I think our concern is that we can't be a sequestered group, no longer communicating to any of our communities or other organizations that we belong to. So I think it will behoove us as a board and to quickly clarify how we can continue to be members of our community with and still and keep people informed and have our ears open. The task force did some things that I thought were very good on that we might be able to pattern after, but that is going to be a subject for our next meeting is how we can resolve that issue.
Yeah.
And then, Tom, thanks for bringing it up. I think one thing that would be helpful is for all of us as board members to understand the budget. And, you know, that could be really quick, but I think it's gonna be important.
So a budget presentation potentially.
But a budget for, yeah, for us, how much we
Yeah.
have for consultants, et cetera.
The other thing that kind of came up before, was there any response from the legislators about Governor Kotek's letter? If there was any, because she addressed it to them, if there was any response from them? Because that related to funding as well, I thought.
Yeah. My understanding is that the signing letter asked for clarification during the February session. And I don't believe that clarification happened in any formal way. Okay.
I have a quick kind of report to the board, given the legal requirement. The Mid-Valley Healthcare Advocate, which is one of the oldest group advocating universal healthcare in Oregon, they are planning to have a public meeting on the weekend of May 18 to 19, and they're inviting both Warren and me to participate, and we will not represent the board, but we will mainly be a hearing what the public are talking or concerned about it.
Can you send an email to Morgan about that, Chenwei, and make sure we get that on the record? And
Yes, the date is not finalized yet. Once the date is finalized, I will send that email to you.
Okay, great. So did you have something? Oh, okay. So it's my understanding that the task force would end every meeting with a quote or an inspirational saying or
Haiku.
And that's something we would like to continue here as a way of closing out our meetings. We might tap each of you as volunteers to close out our meetings. It could even be a story or something that you heard from the community or something that inspires you. But I think Warren suggested this quote. Do you want to close us out, Warren?
Yes, I was greatly inspired by Bruce. I'd never written a haiku before. We had enjoyed that, and it was often helped us leave the meeting on an interesting, thoughtful note. So I was proposing that we offer a haiku or a short poem, and I offered to go first. Much of the work that we're going to be doing is very data driven, but here is a quote from T.S. Eliot that I like well enough that in my 40-year career had it calligraphied and hung on the wall over my desk. Where is the wisdom we have lost in knowledge? Where is the knowledge we have lost in information? T.S. Eliot.
Okay, thank you.
I think that's everything. So the meeting is adjourned, and I will be working with the chair and the vice chair and taking all of the suggestions that you had for future meeting topics, and working to have some great presentations, and look forward to seeing you all here or online in May.
Thank you all.
Thank you.
Thank you. Thank you very much.